Welcome again to our course on biodesign, strategies for innovation and design on bioengineering. Today we're going to look at the topic on disease state fundamentals, but so far I want to comment on the things that we have seen so far. So first we have defined what a medical device is and what the space of medical device development and the biodesign process looks like. We have talked a little bit about building a strategic focus with acceptance criteria. We have talked about performing meaningful, effective observations, and we have talked also about how to performing good need statements. And with all that in mind, I want to introduce you to this topic on disease state fundamentals, which is something that could complement the same way as the other lectures, your clinical rotations to make them as effective as possible. Okay, so disease state fundamentals is the topic on how to provide information for you and for others on what is the clinical relevance of that situation, okay? And if we go to the first slide, we can see the objectives of these presentations, which is to know the importance of performing a disease state analysis, even before and after going into clinical immersions, to detect the key factors to investigate as part of your research. And again, this could be done before and after going into the hospital or clinic to detect problems. I want you to appreciate how to effectively search for information that is going to be useful for you to aid in your needs screening process. You're going to see that after going into these immersions, you're going to have a lot of needs for you to filter down. And the best way of doing this from the clinical perspective is to knowing the problem. And that can only come from research, as you will see now. And we're gonna end up with a practical case in this video section. I also want to remind you that there are practical cases for every single presentation, but you can access that outside the video format. Well, so the first part of a disease state analysis, I believe, is the epidemiology part. Epidemiology is the science of collecting, citing, and presenting effective statistical data to a clinical problem. So the epidemiology is the part of the science that studies how a disease spreads, how a disease presents in people, how often, and how in what fashion. And that's a science that provides us with statistically significant data, well, hopefully statistically significant data on the relevance of a certain disease or problem. So as to now, we have talked about diseases or problems in the clinic as our main focus for the biodesign process, but you should know that when looking at epidemiology now, what we're going to try to see is not only the data on how many people suffer from these conditions, but also how many doctors have to deal with this problem and how many hospital administrators have this specific problem, which might or might not be clinical. It might be administrative or economical. But the thing is that when talking about epidemiology in the context of biodesign, of course we're going to analyze the scientific part with incidence and prevalence, but also the idea of how often this type of problems happen on a certain environment. So again, epidemiology has to do with collecting, citing, and presenting effectively statistical data that is relevant to a clinical problem, nationally or globally or regionally. So the concept of epidemiology comes from some of the studies of a very big persona called John Snow. John Snow was an Englishman that in 1855 was capable of relating a tendency in an outbreak of cholera in London, one of the biggest, more dramatic clinical events on history, and he was able to pinpoint the root cause of that pandemic through the localization of water wells. So what John Snow discovered eventually is that cholera was in a time where people thought that cholera was spread through any other means. He discovered and proved that cholera was related to drinking contaminated water from certain spots in the city, which were infected from sources as sewers and waste waters. And with this in mind, you can see the relevance of epidemiology, because not only John Snow was able to know exactly how many people was affected by this disease and how many people died from that disease, but also by knowing the epidemiology, by knowing the statistics behind a disease, he was able to target the root cause, the most important factor that had to be solved to solve that problem, which relates essentially to the creation of effective need statements, and ultimately to the creation of a good solution in the bio-design process that you are undertaking. If we go to the next slide, we can see that epidemiology in a more formal way is the gathering of data from individuals, the healthcare system, politicians, and physicians that considers all the statistics and demographics needed to know if a certain disease is genetical, it comes from genes, or it's just a pathology that can be caused by exposition to certain chemicals, or if it's a physiological response to a certain event, or if it's an effect of a certain drug, a pharmacology effect. And this is important because by gathering all that data, it's going to become crystal clear that there is a problem out there, and that by solving that problem, you're doing something meaningful for society, and hopefully also something meaningful for economics and for doctors and patients. So when you think about epidemiology, what you have to know is that a good epidemiology analysis has to consider, in the context of the bio-design process, has to consider all the statistics relevant to the disease. So how many people is affected by this annually, how many new persons are affected by this, so your incidence and your prevalence, how the statistical significance of all that data, and of course to provide numbers, crude numbers on how many patients or doctors or hospital administrators or clinics are affected by this single problem, and what is the demonstrated root cause of that situation. And by doing that, by putting that in very simple lame terms, you're going to know that you're going to have a strong data to support all your designs. Another part relevant to a disease state analysis is the anatomy and physiology. So when thinking on an anatomy and physiology research, what you have to consider is that not all the problems have to do with anatomy and physiology. Some have to do with habits of clinicians and nurses. And when exploring the concepts in the bio-design group book, you are going to see that one of these disease state fundamentals is to explore anatomy and physiology. But I would say that the important thing is to analyze the anatomy, the physiology, or the normal situation that should happen, the normal and the problematic situation that it's happening in this clinical environment. So for doing this type of analysis, you have to describe briefly the anatomy, the physiology in the normal situation and in the pathological situation. So the normal situation is, which organs, which patients, which professionals are doing what, in what context, and that does not cause any problem. So in the case, for example, of a lung disease, in an anatomy and physiology analysis, you would expose all the anatomy of the bronchi, of the lungs, of the pleura, all the sections, all the lobes of the lungs, its anatomy, and of course how it oxygenates blood and how it liberates waste gases into the atmosphere again when you exhale. So that's the normal situation analysis. In the case that your problem is not strictly, it doesn't have a strict anatomical or physiological context to explore, then you have to describe thoroughly what is the normal situation that happens. So what is the normal workflow in this area? What is the normal way in which a patient is treated? What is the normal ideal way in which this has to be done? And that's the normal situation analysis, okay? After that, what you have to do is explore what is wrong. So the problematic or the pathology or pathophysiology and the problematic continuum of the disease or the problem that you want to solve. In this case, you have to explore thoroughly the mechanisms of the disease, why this happens, when this happens, because of what it happens, and the way in which it presents, okay? It presents very in an acute way, how much it takes from going to point A to point B, the disease. Does it take years to complete all these stages? Are there stages? It's a one thing, it's a thing that passes from a normal state to a very pathological, almost deadly situation. Okay, if it worsens, if it stays the same way, okay, and every stakeholder also that is involved in the problematic situation, because what you're going to see is that sometimes all these problems not necessarily come from the devices used right now, but they could come from the bad use of all the devices that were not designed to target the people that they were supposed to target. And so basically for an anatomy and physiology or problematic continuum analysis, what you have to do is include everything, okay? Everything that you and your advisors believe it's relevant to understanding the gap between the normal and the problematic situation. Everything. And please be as thorough as possible. It doesn't matter how extensive you are, but at the end, if it's really extensive, you have to create a summary or an abstract that describes the main points that you have discovered. One of the ways you can explore this anatomy and physiology research is, by understanding how much you can know about this normal anatomy or physiology, and also what can you know about the problem. So what you're going to know is that sometimes there is a lot of information about the problem, and that is good. It's going to make your value proposition stronger. But if there is no extensive research on all the problematic situation that surrounds this problem, then you're going to have to do that research, or at least you are going to have to interview people or to try to dig very deep for data that justifies from an anatomy and physiology standpoint or problematic continuum standpoint that you understand the problem. The idea of all this analysis is that to prove to you and to everybody else that you know your problem, because if you know your problem, then you are most likely to solve it. One of the main things that you have to explore in this disease state fundamental is to lay out the main affected of the problem. So even though in a certain problem or disease, there is probably many people that are affected, the patient, the doctor, the hospital administrator, the family, even though there are many people that are affected by the problem, there's always someone that is the one that is the most affected. And in this case, okay, you have to lay out everything that surrounds that patient and everything that happens to that patient. You have to define it. You have to define that person so that you know who you are trying to save from this problem, okay? And in this, you can generate a written or visual profile of or the patient or the person that is deeply involved in this problem. Okay, so who is him or her? What does affect him? What are the concomitant or associated disease or problems that surround this main problem? What is the environment? Is it a clinical environment? Is it an outpatient environment? Is it a home care environment? Okay, is this person old, tall? It's from a certain origin. Does this disease affect more people from South America than from Africa? Does it affect people more from Europe? You try to describe as thoroughly this person. Is that person a woman, a child, a man? What is the age range? Everything that you can know about the patient you should put it. And the way to put it is that I see most effective is in a table that basically defines in a very specific way this main affected with, you can put some sort of identification. It might not be the name of someone. If you know someone with that disease and they give you a permission to expose their problem, then you can put it. Of course, their diagnosis or what is the problem or what the people think is the problem, and the traditional way in which that problem is handled. And this is going to be really important later on in the time in which we explore ways of analyzing treatment options. But by knowing your patient, by knowing the person that is the most affected with this problem, you're going to know for sure that you know your customer. And at the end of the day, even if that person is not exactly the one that buys the thing, then you're going to know that if you build something, if you conceptualize something, if you solve this problem thinking on that person, then it is the most likely thing that is going to happen is that you are going to do a solution that is going to be accepted by this person, which is the main affected. And with this, we conclude the main part of the lecture, and we're going to move on to the practical case, which I think is relevant for you to crystallize this knowledge. And in this case, we can go to the next slide, in which we're going to talk about chronic sinusitis. Okay, so chronic sinusitis, it's important to demonstrate what a good disease state analysis is, because it's a problem that has a very in-depth anatomical and physiological root cause. Okay, so sinusitis, as you might know, is the swelling of the sinus, which are hollow bone form structures within the skull that are lined by a mucosa or soft tissue that generates mucus. And basically what happens in sinusitis is that there is an excess of inflammation or production of mucus in these sinuses, which are, again, hollow structures intended to produce these fluids. But the thing is, what happens many times in chronic sinusitis specifically is that there are polyps or inflammation sources that obstruct the channels used for mucus to go out from these sinuses. What happens is that mucus starts to accumulate in the sinuses of the patients, and that produces pain and more swallowing, and basically it's a condition that affects how the patient feels, how the patient can perform in work, and it's basically a detrimental disease. In the case of very chronic sinusitis, is a condition that might even produce intense depression for the people that suffer from it. And so what you have to know is that in the types of problems such as in sinusitis, what you have to know is to know your anatomy and physiology really well. So in this case, this is a very simplistic case of how you explore it. But basically, you define your patient. Okay, so my patient is all chronic sinusitis patients from 18 to 65 years old. The age doesn't matter that much, but basically it's a person that has a lot of swallowing in the sinuses. And after that, you have to explore all the anatomy and physiology. So what is the root cause? Is the polyp formation? It's a typical inflammation of the sinuses? Is it an anatomical problem? Is it a physiological problem? Okay, and you have to explore, in frontal, from the front, from the back, from a side, and basically you have to explore all the anatomy that surrounds this problem. Because if you only consider that the sinus problem is a problem of pain, then you're going to try to tackle the problem with a painkiller, and that might not be the final root cause. So in order to know the root cause of a problem, you have to know your disease state, and in this case, exploring all the anatomy and physiology of problems such as sinusitis could be a good practice for you. So I encourage you to explore more about this problem, which is something very trendy right now in terms of solutions, but at the end of the day, I think it's a very clear example of a problem that is suffered by many people. Of course, in the sense of epidemiological data, you can explore more how many patients and if the ratio between women and men that are suffering from this is bigger or less. But at the end of the day, you can see that performing an effective disease state analysis includes epidemiological data, knowing your patient, knowing the person that is suffering from this problem, and knowing all the anatomy and physiology or the normal and problematic continuum of the care of a certain patient. So with this, we conclude with the course, with the lecture on disease state fundamentals. If you want to know more about this topic, you can always refer to our biodesign book from Sinus in the chapter on disease state fundamental. And see you later.